Okay, so we're going to talk about the core concepts in pharmacology. The big thing with this is really getting to know the terms associated with pharmacology. So as you go through, you really want to just really primarily memorize these terms and understand the differences between them. What does pharmacology mean? It basically is the study of drugs. It's the study of medicine and how medications work in the body and the system. So you're going to be really learning, and one of the best things that you can do is start learning by classifications. So again, what is a drug? The drug is the chemical agent that produces a biological response in the body. What does that mean? It means that it's going to cause the body to have a desirable, which would be therapeutic, or sometimes you'll have an undesirable, which is your adverse effects. What you really just want to look at, so that's when it's administered, and it's a medication after the drug is administered. So they're basically considered, something that happens, in the body once the patient has been given the drug. So the drug is the chemical agent, the medication is once it's given. We've given them this particular medication. They're used pretty much interchangeably, but from a definitive way, that's the difference between the two. The other big thing that we've emphasized more throughout this course, and you'll see as we go through different classifications of medications, that the complementary and alternative medicine therapies can interact with drugs. They can be used instead of drugs. So it's another big topic that we'll talk about in many of the chapters throughout here. So it can be plant extracts, it can be herbs, vitamins, minerals, supplements, other things such as oils. A lot of stuff is being used now for complementary and alternative medicine. Why is that important? It's important because you'll learn very quickly that they can interact with many of the drugs that you'll be given throughout your career as a nurse. So you always want to make sure you're asking your patients not only what medications they are taking, but also include, do you use any alternative medicines? Because a lot of times they don't see that as a medication. So therapeutic is the usefulness in treating, these are the different types of classifications of drugs. So the classification for therapeutic would be something that it's defined as their usefulness in treating a disease or disorder. So you can see on the right-hand side are some of the different things that you would call their therapeutic use. So analgesic, so it takes away pain. They're antibiotic to fight infection. So these are the different types of therapeutic classifications. Then we have our pharmacologic classification, which basically is how the drug works in the body. The FDA basically says a lot of times this is defined as the mechanism of action, the physiologic effect, or the chemical structure. But these are some of the examples of the pharmacologic classification, which would be your beta blocker, your diuretic, your statin, those types of things. So an example, so Zantac would be your trade name, ranitidine is your generic. Usually your generic is in lowercase. And all of your test questions will be your generic drugs, just so you know, not only within the program, but also on NCLEX. So for ranitidine, your therapeutic action is that it's an anti-ulcer agent, and the pharmacologic is that it's a histamine antagonist. Then, as I had mentioned, our generic versus our trade names. Your generic is going to be your lowercase, and these are some examples, and your trade name is on the right. What I want you to do is practice and look at these. So you might want to pause your screen and come back to this. So match up ibuprofen. What is the trade name for ibuprofen? It's not Tylenol, it's Motrin. Acetaminophen, what is the trade name that's associated with the generic? It's Tylenol. So the generic name is the name that everyone knows it as. Why do we go by the generic and why are you tested on generic? Because the trade name, there may be multiple trade names. The trade names that are associated with our generic can change. Why can it change? Because the trade name is always associated with the company that is marketing the drug. So there may be different people marketing it. It usually takes about 17 years before a drug can be marketed. They'll have proprietary rights to it until that 17-year window has passed. So for a long time, you may only have one trade name, and then once that 17 years passes, you might have tons. Ibuprofen is one of the big ones that you'll see that with, as well as acetaminophen. There's many people that will manufacture these. Getting back to here, aspirin. What is a trade name for aspirin? Bayer. Diphenhydramine, what's the trade name for this generic? Benadryl. You're going to have a worksheet that's going to correspond with this, which we'll give you, and you can practice doing this with the worksheet. How do you go about figuring out the trade versus the generic? You can use your drug guide, or you can use the textbook. Either way, get used to figuring out which ones go with which, and then we'll post the answers for you too. Have a great day.